Hi, I'm Dr. Rahman and I'm a board certified OBGYN. One of the things that women sometimes tell me, and I think it's only because they have the time when they come into the office to actually talk, is that in other offices they have not felt listened to. Their opinion about their own body has not been valued. And because of that, they feel dismissed. And it's a feeling of dismissiveness that makes them feel less inclined to want to go back to see that provider. And there may be a lot of reasons, and not all of them are a deliberate dismissiveness on the part of the healthcare provider. A lot of times providers are truly doing the very best that they can in a very busy environment when they only have so many patients before they have to see someone else because there's a waiting room full. And so because of that, it's hard to sometimes get all of your story out, particularly if you wait to the end. It's better to come in telling your story and then to wait to the very end and say, oh, by the way, I have this other issue. Because by the time the doctor is trying to reach for the door, that's not the time to bring up a sensitive issue, which is often the time when people feel at least the most comfortable of bringing it up. They've already gone through the preliminaries with the doctor and they feel like, finally, I can bring up the issue that's really been at my core. But by this point, the doctor's trying to go. And so it's hard. It's a hard thing to do, especially when there's only a certain amount of allotted time per patient. So I would suggest that if you have concerns, jot them down in advance, prioritize them even, and then make sure they're known up front, and then don't leave. Don't leave until you get the answers you want. Or if you don't get the answers you want, come see me.